Hi, I'm Taylor,
And I'm Josh.
and our muscle is peroneus longus. Now here's a word from Peroneus herself.
Hi, my name is Peroneus longus. My actions include plantar flexion, dorsiflexion, and eversion. I work on a sagittal plane and x-axis.
One of the most common exercises that incorporates the peroneus longus are calf raises. As our model performs calf raises, the concentric movement is here as she plantar flexes. As she dorsiflexes, it's eccentric. Concentric, eccentric, concentric, eccentric, concentric, eccentric.
Now a word from Larissa Rooks, Doctor of Sports Medicine.
An eversion ankle sprain is an injury to the medial or inside ligaments of the ankle that occurs after forceful inward rotation of the foot. Unlike in other sports where pivoting and cutting actions result in a rollover of the ankle where the foot goes inward, in hockey, the foot is in a rigid skate, and sometimes the blade can be caught in an ice rut and be forcefully turned upwards and outwards, resulting in an eversion sprain. A hockey player might experience acute pain on the medial aspect of his ankle and will have difficulty weight bearing. It's really important that an athlete sees their primary care sports medicine physician when faced with this problem. Due to the forceful nature of this turning of the ankle, other associated injuries should not be missed. As with other ankle sprains, it is really important in this situation to rest, ice, compress, and elevate the injured joint. In addition to this, seeking help from a physiotherapist would be really important to start on an ankle rehabilitation program. Bracing is a great solution to minimize the feeling of instability in the joint. This would be true both at the time of injury as well as long term. It's important to seek medical attention for this particular injury early because of the forceful nature of the injury itself. Oftentimes there can be accompanying associated injuries such as a widening of the medial joint space or a fracture that is not noted immediately. If you have further questions, please consult your family physician or your primary care sport medicine physician.
Thank you, Dr. Larissa Rooks. Now let's go to Sparta to see what Leonidas has to say.
Hey bro, so I was talking to Wayne the other day about some leg workouts. Have you seen those trunks? They're huge! He was giving me some exercises for the calves. You know I want those babies to be like cows.
Tell you what, brochacho. You need to stop milking leg day and start hitting that peroneus longus hard. That puppy originates on the proximal fibula. The insertion point is at the 5th metatarsal and plantar surface. Is that a subtalar joint? Yes, it's a synovial condyloid joint. What's the bony landmark?
It is the lateral malleolus. Dude, it has pennate muscle fibers.
Oh yeah? The synergist is the peroneus brevis.
Then the antagonist is the tibialis anterior.
Look at me. I'm in sandals, and I still walk, rollerblade, cycle, and can stabilize myself walking up these hilly mountains. Or maybe I can balance on a rock for some stability. Can I strengthen this muscle?
Yes, calf raises. So it's just a calf muscle?
A calf muscle? This is Peroneus longus! The Peroneus longus is not just the captain. It is accompanied by the Peroneus brevis and Peroneus tortuus.